As we move through the autumn here at the Trust, I am pleased to bring you another roundup of this month's stories. This month we heard from Professor John Wright, Director of the Bradford Institute for Health Research, about the Institute and how it claimed the top spot for most research volunteers recruited in the whole country for the first time.
Research has always been at the heart of the NHS, and that's how we've led to new innovation and new discovery in the health service. We wanted to do something different from the traditional teaching hospital model that we saw in Manchester or Sheffield or Leeds or Newcastle. They had developed these big centres for molecular research or genetic research. We wanted to do something which was much more people-powered. And so we reached out to our community to find out what their priorities are. We reached out to our collaborations across Bradford and Airedale, across primary care, across the care trust and mental health, and also importantly, not just relying on one university, but relying on the best expertise from around the country to come and help us. And that's people-powered collaboration has paid off hugely over the last few years.
Thank you to John and the whole BIHR team. To mark Men's Health Awareness Month, we also heard from Dr Chidi Molokwu, consultant urologist, who emphasised the critical role early detection plays in improving outcomes for prostate cancer patients by increasing the chances of successful treatment and survival.
So from my experience of doing these awareness campaigns, a lot of men don't even know they have a prostate. It actually allows people to talk about it, ask questions.
But I think most blokes, in my experience anyway, don't talk about illness. Clearly cancer's a big scary word, isn't it? I've told all my friends, all my male friends, there isn't anything about it that's remotely awkward or painful.
So fundamentally what I would like is every man will know that when they turn 50 or 50-ish, they should get a check. Every man will know that if they have problems passing urine, they should get a check. Your GP should always be your first port of call if you've got any health concerns. Yorkshire, we have all the treatment centres. We're here waiting to treat you, but we can't treat you if you don't actually show up.
Get checked, go to your GP and get a blood test. It's painless and could save your life.
Thank you, Chidi. We also learnt about the practice education team's work from Rachel Mathers, practice educator, and Sarah Scholes, practice education lead, who shared with us how their team provides support to a wide range of students undertaking their clinical placements here within the Trust.
We support our students when they first come on placement at the Trust with a Trust induction. Here we set standards about the expectations that we have of our students, our Trust values.
We talk about communication, we talk about uniform policy, confidentiality, all the key things that are really important.
And we offer sessions alongside, such as our twice-monthly multi-professional learner forum, and then sessions such as foundations of patient care skills.
They need to have hands-on practice, which is why they come out into an acute trust. Those key things that they're learning from the experts. It's about enriching that experience and creating an action plan to give them the things that they need, the tools that they need to be able to pass and grow and develop in their placement.
Thank you, Sarah and Rachel. On this month's podcast, we heard from consultant uro-oncologist and urological surgeon Ranjinder Singh, who told us more about robotic surgery and the amazing benefits this has for patient care.
I think robotics is the future of surgery, and that view certainly was expressed by the Royal College of Surgeons in a review of robotics last year. Here in Bradford, we started with urology, and then head and neck came on board, and gynecology, upper GI, lower GI. We started with one robot, we upgraded to a new one, then got a second. And I think sooner or later, we're probably going to need a third. Every bit of surgery has robotic applications which could become suitable and the norm in the future.
Thank you, Raj. Finally, here's a look at some of the other exciting things that have been happening around the Trust this month. That's it for this month's update. I look forward to sharing more stories from the Trust with you next month. Don't forget, all our latest news and updates can be found on our social media channels, X, LinkedIn and Facebook.